Now we are recording. All right. Hello, everyone, and welcome to Health Chats Among Friends. So, I have a good friend here today, Ryan Lablanc, and Ryan is going to share a little bit about who he is, what his passion is, what he's doing to help the community. And we're just so happy to have you, Ryan. Hi.
Thank you. Thank you for having me, Deidre. So first and
Oh,
foremost, I'm the administrator at Mira Vista Court out in Fort Worth, Texas. So that's 24/7 there running the nursing home, especially right now with COVID. It's different times for sure. It's crazy. It feels good to not have my N95 on right now and doing a Zoom meeting because that's usually how we're operating, but in the buildings. And so talking to my team or anything like that during the day, we do Zooms and we're all in the building. So we still got to have our mask on. So it feels weird. So it's getting used to it though. But yeah, no, I wanted to talk about American Home Help. So it's basically the technology company that I started, been working on it for a few years now. Being a nursing home administrator, it was just the way things would work out. I would have to step in as a social worker at every building that I was at. So they would uh, just have a baby or, something would come up and I would have to step in for about a month. And, I thought it was the hardest job ever, trying to find resources for patients and then just being the middleman with the families and the other services and making sure everybody's on the same page. It was just uh, time consuming and difficult. And I just thought there had to be an easier way to do it. And so, that started a 30-bed facility, and then I went to a 60-bed facility and had the same issues, and then 120, and then 180.
wow.
Yeah, so, and it just is, as time progresses and changes in the industry, more insurances and, you know, companies might accept insurance A as of yesterday, but now it's the first and they no longer accept it. So now you're starting back over at square one and stuff like that. It gets more difficult. It's more clouded to work with each other, and so it just kept driving me. I just knew that there had to be an easier way to do it, and so I tried to make it happen, and still got a long ways to go, but we are starting to make some progress, and super
But it's a
excited about it.
start. It's a
Yeah,
start. I think it's amazing that you came up with that. So basically, it's providing resources in the palm of your hand.
yeah, exactly. So something like your company is a perfect example. So like the goal is to try to make it to where companies such as yourself can focus on having a good product and not putting time and effort to get in front of people. So I mean, like, I feel like in healthcare, especially like non-medical and some of the smaller companies that are all around us. I mean, because we're in DFW, so there's probably like over 100
Oh,
non-medical
yes.
companies.
Mm-hmm.
But I can
Mm-hmm.
name three, and I've been in the industry for 10 years and I live in the area, so I should know more. And it's just hard to find those people because maybe they don't have the resources to put the money into marketing to administrators at nursing homes and stuff like that. So I just want to try to help connect those dots to where people can focus on having just a great product with the families and the patients whenever they connect with them.
So
um,
how are you getting the word out about, your app?
so right now, just blessed to be over some of the Facebook groups and just trying to spread the word that way. Trying to get the app to a better place, you know directed more towards the families and patients and not so much the healthcare employees. So whenever we get to the point to where it's I think it's at a good position to where a family member can get on there, connect with somebody like you quickly, and there's an easy handoff process to your services and stuff like that. Then we're going to start pushing it with partnerships with the hospitals, and then
Oh,
just
that's awesome.
the marketing online and all that stuff. So outside of the Facebook groups, really. So
Yeah, I believe social workers would love it.
yeah, so I mean that's the majority of who's signed up on it so far is social workers and getting good feedback. This is the second system that I built. So I built the first system, had about 1,000 people on there, spent like a year just trying to get suggestions and complaints and just getting feedback. And after had a good idea of what people were looking for, spent some more time building it out. And I think it's at a good place now. So um, proud of it. I'm excited, just trying to keep connecting those pieces. And, because like I said, I originally built it for social workers. So the fact that, they're seeing the value of it already, makes me very happy. So,
Yeah. And I want to go back to something too that we talked about earlier. So your app is Home Care,
American Home Help. Yeah.
American Home Help. Okay.
Yeah.
Okay. So American Home Help, everyone. So how would
So it's
someone,
in the Apple store, it's in
good,
the Google store and all that stuff. I'm
good.
just not like not trying to push it yet, just because it's not at a place to where I'm
Okay. Okay.
confident
Well,
about
it's
it.
going to
But
get
people can
there.
still use it. So,
Yes,
because
it's
like you
going to
could
get
get
there
on there
before
and
you
connect
know it.
with, I think there's like 140 healthcare professionals that you can get on there to direct message, call, send an email, and there's like 60 companies, including yours, so that people can connect with. So, but
That's awesome.
yeah,
I want to go back to something that you said earlier too, because I think a lot of people don't realize that we're humans too. We have families and things like that. And, there was some controversy in the public setting about the mask. And, I heard you say, you wear the mask and you're grateful that you don't have to wear it in front of a Zoom call. And I really appreciate that you said that because um, we have families that we come home to. Um, we don't want to wear the mask, but me personally, I wear the mask to protect others.
yeah,
And, I know you wear the mask to protect others. So I just want to commend you for saying that
yeah.
because it's a responsibility. We all owe to one another.
So, I mean, it's going through this whole process. I've learned quite a bit, and I had state come in, their like infection control SWAT team, to give like suggestions and stuff like that. And they came and they graded the masks that we had, and they weren't. It's called NIOSH. That's like the official. I don't know if it's really a company or a government entity, but they are the ones who say whether a mask is like legitimate or not, like the N95s. So if you have an N95 mask, it needs to have a NIOSH sign on it, and that means it's 98, 99% effective against COVID and other stuff like
Right.
that. So state came in and basically told me all my masks were no good. So we had a stockpile, like we were finally getting some, and they turned out to be not good enough. So
Oh
I
my.
was started scrambling around, trying to figure out, because I mean, basically they were telling me, you have everything else, you have best practices in, but if you don't have the right mask, that's all basically pointless.
Wow.
So, connected with the state, and I was able to get a emergency supply of the N95s, the legitimate ones. And we had a situation where COVID enter the building we had it enter the building, but I luckily had the correct N95s at the same time, or at that time. So as soon as we found out, everybody had to go from the regular mask to the N95s, and I mean we flatlined. So it's didn't have any more new cases, and everything's been pretty
That's
good.
awesome. That's
Yeah, and
awesome.
so I mean that's we I'm gonna try to just have my staff keep because nothing's changing. So we're just gonna try to continue to use the N95s properly and wear them out,
Right.
until I can't buy them or find them anywhere anymore, because it's going around all the time. So I get daily
Yeah.
updates from the health departments, and Tarrant County's up to like
CDC. Mm-hmm.
500, 600 a
Right.
day now. So I mean,
Right.
it's everywhere. So, and as
Yeah.
employees, we're the biggest risk, because we go out, we go get food, or all this stuff. So I mean, we're the biggest risk to the building. So making sure that
Right.
we're all in the mask is the safest, for the residents. So
Absolutely. Absolutely. We got to think about others. Well, I love your app.
thank you.
I think it's a powerful resource. Um, I'm excited about it, and I'm so grateful that you decided to take some time out of your busy schedule and come and just chit chat with me and, help
Sure.
educate the community about the resources that are out there.
Yeah.
So I would
Okay.
love to, definitely keep in touch and be able to be a resource, vice versa. Um,
Absolutely.
Wonderful thing. So, how do you feel about some of the seniors that may not be so tech savvy? Are you
Yeah, so I
thinking
mean, I
that?
think really, usually it's the family who's searching for help, or it's the social workers or maybe a patient advocate. So, it's those kinds of people that, really is the target market for the platform as far as trying to connect the resources and, just ideally it's a one-stop shop to where, like they can go there, connect the dots with maybe somebody like you helping, go to the doctor and then find the nursing home. So where it just kind of smooths out the roadmap to where it's a faster, easier process, and then that's going to lead to better results. And so,
Absolutely.
it's I think we're at a position now where some of the older generation is getting a little more comfortable with technology. Like right now
Mm-hmm.
in my
Mm-hmm.
facility, we do a lot of Zooms with the family members and stuff like that. So that's, how we're able to get them connected, because obviously they can't come in the building right now. And, that's a very difficult time for a lot of people.
Yep.
But, so I mean, I think it's
User friendly.
advancing. Yeah, yeah, exactly. Yeah.
Mm-hmm.
So,
Yep. Yep. That's the point I wanted to get across, that is user friendly. So people don't say, oh, no. A lot of people are like, oh, technology, I just can't do it. But this is
yeah.
a user friendly, straightforward, great app. And I'm
Really
so
just
excited
a
for
just a
you.
handoff, like it's just we don't do anything but just, give you options of what you're looking for. Like if somebody, ideally, whenever the app is to a point to where somebody can go on there and say, I need to go to the doctor. I don't have transportation. We have the, transportations that come up, and then we see, oh, you're going here for transportation. Do you need a patient advocate to go there to help you with that appointment and stuff like that?
So
So
let me ask you this too, speaking of that. So, what area are you covering? Is it just Dallas Fort Worth? Are you
But
going
just
to
starting out with
expand?
DFW right now, just because of,
Okay.
the Facebook groups and our network, and
Right.
just trying to get it to a good point, and then we'll venture out, whenever we have the system to a good place. And
Me too.
yeah, yeah, definitely. So,
Yeah.
I mean, I'm excited about the opportunity to try to help you grow your company, because it's
Oh,
exactly the reason of like why I'm trying to do this. Because like, for an example, my wife, she's a doctor, or she's a nurse, and she helps her family out going to the doctors all the time,
yeah.
and keeping up with stuff and keeping track with stuff. And it's, if you don't have somebody being that advocate, things can go,
Get
they can they can take a dramatic turn,
Yes, sir.
you know
Yes, yes,
line of
yes.
one medication or something like that. So
Right. Right.
so it's I'm just excited about the future and the opportunity to work together with it. And I can always use your feedback and what we can do better. And I'm just hoping that I help you grow your business. And that one day we'll look back and you'll think that it was worth your time signing up with us. So
Awesome. Well, Ryan, I just want to thank you again for your time, um, and continue to push forward. And we are a team out here. It takes a village to do what we do. It is about passion and wanting to provide the right resources. So thank you, everyone. Ryan LeBlanc. How can they get in touch with you, Ryan, if they need to?
they can shoot me an email at ryan.leblanc@americanhomehelp.com, info@americanhomehelp.com, and www.americanhomehelp.com. So all the normal ways, and all my information is on there. So, or they can just download the app and push a button to call me or send me an email. So
Yes, yes, yes. Well, thank you again for your time. And this is Health Chats Among Friends, and we look forward to chatting with you guys soon. Please don't hesitate to reach out to myself or Ryan. My number is 817-854-3240. What my company does, we are nurse advocates, educators, and navigators. So we love helping you navigate the complicated healthcare system by providing resources for you and your loved ones. Thank you again, and we will see you guys next time.
thanks, DJ.